Hello YouTube, this video is for anybody who's planning on going through some back surgery or maybe had back surgery and wants to do a comparison. I had surgery done on December 12th of 2019. Today is mid-January roughly. So I had documented everything that I had done, all my pains I went through, my rehab stuff so far. And I'm gonna break this up into a series of videos. So this first one will cover the first 7 days. So the day of the surgery was December 12, 2019. You change out to your gown, etc. Prior to the surgery, I took 2 gabapentin, which is a nerve block. The doctor had told me, meeting with him prior, that he would be injecting some kind of painkiller into my incisions, and those painkillers would probably last over a period of 3 days. I met with the anesthesiologist, and that's pretty much all I can remember. I woke up back in that same room where I met the doctor and the anesthesiologist and the prep people, and I was really groggy. I know the doctor had come back in, but I really don't remember anything that he had told me, at least for the first 2 hours. Anybody that came in, I don't remember pretty much anything. What I do remember was pretty much severe pain in my back. And that was the hardware where they put into my spine. So I have the pedicle screws and the rods holding L4 and L5 together, and I could definitely feel that in my back. On a pain scale of 1 to 10, it was probably an 8. So even under the medication, I was groggy, etc. It was sore. Prior to going into the surgery, I had picked up some pain pills, and besides the gabapentin, which was 100 milligrams, and I'd be taking 2 of those every 12 hours. I was also prescribed oxycodone, which was 5 milligrams one pill every 6 hours, and something called Senna S, which was a stool softener. So the painkiller, the oxycodone, kind of makes you constipated. So that Senna is to offset that, so you can get your bowel movement back to normal again. Now, the surgery itself was probably about 3 hours. I went in the morning, and I stayed in the recovery room about 4 hours. So the first 2 hours after you wake up, you're groggy, you're not going to remember anything. Maybe the last 2 hours after that, you start remembering things, and then they go over some of the things that you're supposed to do at home, like how to get in and out of bed, and the issue your back breaks, etc. at that time. At least my physician did, which I don't think was a very good idea. I think that should have been done in the pre-op meeting that I had done previously, because I was still groggy at the time. So when I got home and I was doing stuff, I was remembering, am I doing this stuff right, etc. So this is still the same day of the surgery. It was an outpatient type of surgery where I got to go home after that 4 hours in the recovery room. I remember sleeping on my side. So the incision, it was on my right side. I slept on my left side. I probably slept in 1 or 2 hour blocks. I slept very well, and I was able to get back to sleep probably within 45 minutes of waking up in those 1 or 2 hour blocks. Maybe about 2:30 in the morning, 4:30 and 6:45 of that first night when I got home, I used my walker and I just walked inside the house maybe for about 5 minutes. I mean, you're walking really slow, and you're gonna need a little bit help because your legs are still a little bit shaky at that point. The most difficult part was getting in and out of bed. Your body has been through a lot of trauma at that point, and everything is really weak, and everything is really sore. So that was the day of the surgery to the wee hours of the morning, and I will get to day 1 next. So day 1 post-op, this was from about 7 o'clock in the morning. I'm considering this. The pain in my back from the hardware was probably an 8 out of 10. My hip pain came out of nowhere. That was probably an 8 out of 10 also. In both hips, it felt like the pain medications were not working at this point. My first bowel movement was at 5 p.m. that night. It wasn't that good, but at least I had something. Maybe about 8 p.m. that first night, I just started feeling the pain medication kind of kick in. So from that 8 out of 10 pain level, it probably went down to about a 7 out of 10. During that first day, I probably did about 40 minutes total of walking over maybe 6 sessions. Various times. As soon as I got tired, I'd go back and lie down for an hour, maybe 2 hours, just because you're still weak at that point. Again, I slept well. maybe in 1 to 2 hour increments, and I was able to get back to sleep pretty much within 45 minutes. I still slept on my left side that first night. At this point, I didn't have any incision pain, so that nerve block or pain block, whatever you put in for the into my incisions, was still working. So it was really, really good at that time. Again, I woke up, you know, in the wee hours of the morning again at 3:30, 4:45, and about 6:45. I did my walks again, maybe about 5 minutes at a time. This time I didn't use my walker, but I still walk very slow, and it wasn't the easiest thing, but it did help loosen me up, because if you just lie down, you're gonna get really, really stiff. They encourage you to walk as much as possible. So my particular prescription for the first 4 weeks is try to walk anywhere from 30 to 60 minutes throughout the whole day. You can break it up however you want. So that's day 1. All right, day 2 post-op. Woke up probably with a pain 8 out of 10 again. Now it was in my hips, my back where the hardware was, and my thighs. The pain meds were working pretty much right off the bat. It probably dropped the pain down to about a 6. But as time went on, you could feel the pain slowly coming back. And as soon as I hit that 6 hour, I took that next oxycodone, or that 12-hour period, I took that next gabapentin. And I was consistent with that Senna just to get my bowel movement back into normal order. My appetite started coming back just a little bit. I was eating healthy. The doctor explained to me that eating healthy is one of the key things for your recovery. People who eat healthy is shown, has been proven to have a faster and better recovery than somebody to eat fast food, crappy food, whatever it may be. So even to this point, which is almost a month out, I've still been eating really, really good. I've lost a lot of weight, which I'm very happy for. Hopefully the bowel movement will come back. I'm still going, but maybe once a day, twice a day. Hopefully I get to that real soon, but it hasn't been happening yet. Getting in and out of bed is still very, very difficult. So that's day 2. All right, this is day 3 post-op. The pain in my hips were probably about I'd say a 6. My back pain was maybe about a 4. At this point, the incision pain started to come on. I guess the pain medication that was injected into my incisions had worn off. So my incision pain, both in my side and my back, were probably about a 5 out of 10 at this point. The pain meds were still working, and as they wore off, the pain started jumping back up 2 points, and once I got back on, it dropped back down to that original level. Walking circles on around the exterior of the house at this point, probably in about 15-minute increments, but really, really slowly. So probably what took me 15 minutes of walking with the slowness and the pain that you're in, it's not that severe, but probably should have took me 1 to 3 minutes to do that same amount of walking that I just done during that time. My appetite was still getting better, still eating healthy, and at this time I'm starting to get better sleeping. So instead of 1 to 2 hour increments, it's gone up to 2 or 3 hour increments, and still able to get back to sleep within a 45-minute period. All right, this is for days 4 and day 5 post-op. The reason why they're together is pretty much I had the same symptoms for both days. I've been documenting everything really, really well, so there's no sense that I do 2 separate days. But anyway, the hip pain is probably about a 6, hardware pain 3, 4, my incision pain roughly about a 4. But now there's new pain in my lower back and upper buttocks, probably about a 5. I don't know where that came from, but it's there. I started walking laps around the house, and maybe this laps back and forth across my street. My street is probably about maybe 20 yards wide, and just walking a couple of laps back and forth across the street just to get to see the real world outside. Meds are still good. It seems to be wearing off a little bit faster, maybe because I'm getting a little bit more active, but I'm still taking as what's prescribed on time, not taking any more than needed. My appetite, again, is still getting a little bit better, still eating healthy. All right, day 6, post-op. The pain in my hips are roughly about a 4, the hardware pain about a 2, and the incision pain 3. My walks have increased a little bit. I did 2 half-mile walks, about 20 minutes each, between some 5 to 10 minute walks. I'm just making sure that I can get roughly to about an hour every day now. From this point on, hopefully I'll be able to do that. My bowel movements are normal at this point. I also been taking some Metamucil to help, move things along, so to speak. Maybe about 8 o'clock p.m. on post-op day 6, there's a slight burning sensation to my right foot, maybe about a 4 out of 10. This is my first pre-surgery symptom that had come back. It probably hurts me more psychologically than it did hurt me physically, but it was in the back of my mind. So that's day 6. All right, this is day 7 post-op. The pain in my hips are roughly about 3 to 4, and the rear incision 2, and the side incision is roughly about a 5. But it's not just on the incision area at this point. It's starting to radiate, maybe in about a 2-inch radius, roughly about there. You feel it more when you have the back brace on and you're doing your walks. There's some rubbing going on, so it feels really, really raw at this point. It's not to the point where I need to call the doctor. I have my first appointment on day 14 post-op, so I think I can wait until then to see if I have any concerns. I don't see any signs of infection, so that's a good thing. My walking is getting a little bit more fluid. It's getting easier. Obviously, it's still slow, but it's getting better. Progression is getting a lot better than the first day 1, day 2 day. It's still a little bit difficult to get out of bed. I'm not using my walker to get out of bed like I was in the past. It's getting a little bit easier. Still a little bit difficult at this point. My sleeping patterns, I'm getting up to 6 hours straight now. A little bit harder time getting back to sleep because I think is prior to surgery, that's pretty much my nightly average anyway, 6 hours. And at this point was the first time I was able to sleep on my back. It was a little bit sore, but not too bad. I was able to sleep, so it couldn't be that sore, right? I'm happy with my progress to this point, and I'm happy that the pain levels have consistently going down. So this is day 7. I hope you see my next video, which will cover day 8 through day 14. And I wish you the best in your back surgery or your recovery also.